Hey everyone, Mydecine Innovations, their smoking cessation leading research is now showing almost up to 60% of a single dose of macrodose psilocybin is curing people from smoking. Here's the latest. Hey everyone, welcome to the TDR podcast, and I am happy to be joined with the Chief Medical Officer of Mydecine Innovations, Dr. Rakesh Jetly, back to the podcast. Dr. Jetly, how's things?
Fantastic. Great to see you as sort of winter starting for us in Canada. Yep.
Miss Miami, don't you?
Absolutely.
Yeah, that was a good time, wasn't it?
It was great. It was great. It was first time for me. I mean, I've spent sort of 20 years sort of in the military, but also academia. Yep. So most of the conferences I've gone to have been very sort of academic, science focused. And this was the first time to see the scientists and the companies themselves, the investors, the clients. So it was a really interesting mix and quite informative for me.
What was your big takeaway? You found it very informative? Like, is it a big step in the right direction for the industry?
I think it is. I think it is. I think that early on, the idea of having conferences devoted to this subject, I think, are fantastic. Mm-hmm. In the same way, there are conferences focused on psychological trauma, conferences focused on depression, mood. But I think as time goes along, we will integrate ourselves into some of those other conferences as well, and sort of talk about the use of psychedelic medicines in trauma, in depression, in addictions, and come into those conferences. So I think that was fantastic. My highlight, for me, was, like, believe it or not, just actually seeing people again.
Wasn't it nice?
This pandemic is, continuing to go on, and we've built this company over Zoom, like a lot of companies have, and so to meet some of the members of the team. I've met a few of them in person prior to this, but to actually meet some of the members in person, to meet some colleagues. My personal highlight was, sitting on that patio for a couple of hours on one of the days. And, I've got Rick Doblin from MAPS to one side. I've got Matt Johnson on the other. And we're just basically shooting the shit as colleagues about how to help patients, what to do, what about this. And I think the Zoom kind of meetings are so focused, they don't allow these sort of sidebar, casual kind of discussions. So that was just a treat, and the three of us were just talking about all kinds of innovations, different ways that we can help people and move the yardstick forward.
When you talk about innovation, I found it interesting that a lot of institutions in New York are very, very interested, more so, and I don't want to give the comparison, but a lot of people do compare the psychedelics with cannabis investors. Institutions are by far a lot more interested in this space. In addition to that, I also learned that insurance companies will have a psychedelic division. Most will within the next 2 to 3 years, which I found, needless to say, pretty promising. But if you didn't make the conference, and, you talk about the takeaways and meeting people face to face, what would you say as far as the overall growth of the industry leaving Miami and where it's going based on your experience?
I think it's very exciting. I think that it's funny that you mentioned cannabis, and cannabis kind of like the old cousin that we're sort of trying to move past, I think. I think there's two interesting groups there in the conference, and I think the industry, and as we move forward, I've got my opinion, obviously I'll share it with you, but there's a group of necessary people that are, I would put in sort of the evangelical kind of camp, right? These are great products. They've been around for 1,000 of years. They're natural. They're in history. Then you've got the people that are much more sort of buttoned down pharma. These are molecules. Molecules will hit the receptors. They're serotonergic agents, just like Paxil, Prozac, all of these things. And we're going to help people in the same way, maybe better, maybe we'll do this, right? And so the two camps were there. My feeling is that I'm biased. I'm kind of in the second camp. I'm a physician. I'm very much into sort of the evidence, the science, the biology. To some extent, I want to demystify the mystical experience and just kind of understand what's actually happening in the brain and body to help people. I think in the long run, that's what the medical community is going to need. Because otherwise, we're going to repeat what happened in the 60s, 70s, and 80s, where lots of people were helping people, for sure. There's no question, but it was in sort of an underground kind of way, or in farmhouses, or in this. So So I think that it was such an interesting sort of, I wouldn't even say split because everybody was friendly and respectful, but it was an interesting sort of two large groups, sort of, polar opposites in some ways. And one group is really talking about sort of the organic aspect, the ritual aspect, the spiritual aspect, the mushroom aspect. And the other was really talking about novel molecules and improving the medicines that are there, which again sounds, it's more familiar to my world, but it's much more of a biopharm kind of
What's
approach.
your take on that other side of the business side? Like, do you think the industry will evolve and change and move away from that? Is it something that it needs to do?
I think it does need to evolve into more science, not to dismiss the other stuff, because my own background as well. I'm from sort of an East Indian background with yoga and spirituality and all.
Right.
So I don't think we need to abandon that. But I think to be taken seriously as a treatment, you mentioned the insurance companies, right? I mean, the insurance companies, if a drug goes to the FDA, like, with Canada, we'll go back to cannabis. I mean, it's still not a drug. It's still not a DIN. There's still not a prescription, right? A doctor gives somebody it used to be a get out of jail, right? Before it was legalized, it was, hey, if my patient gets caught with this, don't put him in jail. But it's not really a prescription, right? It's an authorization to possess. And I just don't see, Veterans Affairs in Canada is covering the cost, but I just see ultimately these, to get us there, Health Canada, FDA, need to give these molecules DIN numbers, a prescription, a dosage, so that they're taken in the same way where the medical community accepts this as a treatment option. Right. And so I think in the long run, that's probably for larger acceptance where it's going. I think regardless of where things are, I think people trust their physician. I think they're still going to want to go talk to their doc about something, and no matter how much, the industry sort of markets and promotes, I think at the end of the day, if an elderly person is having end-of-life anxiety or things like that, I think their first stop is still going to be their family doc. They're going to say, hey, I heard about this. And the family doc should say, hey, there's evidence for this. I mean, there's places like Johns Hopkins and, Langone Medical Center and Leiden University that are doing it. So I think that's the direction we're gonna need to go.
I think the big takeaway too, and the most important, is just the pure efficacy that it continues to generate, which is very positive. Something important I wanted to mention as well is Matt Johnson's presentation, actually at the conference. Matt is working with you and is a leading addiction research scientist, and there were some positive results related to the smoking cessation study based on the presentation. So do you want to touch on that for some of the positive feedback and what this means potentially for your trials?
It's incredibly exciting. And I think we spoke before about how, like, the impact of smoking, the deaths, I mean, it's more than COVID. It's more than the other addictions combined. It's more than fentanyl. And we just tend to somehow kind of put it in a bad habit, nasty habit kind of category as opposed to an addiction, when it's actually one of the hardest substances to give up, right? And people try 5, 6, 7, 8 times in their life to quit. So again, I mean, hard to believe when you look at some of these figures. You believe them, of course, because they're done properly with science. But one macro dose of psilocybin and cognitive behavioral therapy, the good old therapy that we use to help people to undo habitual behaviors, 100 people that have tried multiple times to quit, 59% of them, maintained, no tobacco a year out after the one.
59%.
59%. We're lucky with other medications, with Chantix, with other behavioral therapies to be 20%, right? 25% is basically the bar.
Well, I think an important is
one dose.
Another important stat to read too is while you have the 59% that you just outlined, 28% of patients who receive the nicotine patch with CBT remain abstinent. So there's a difference there, right?
A huge difference. And in speaking to Matt as well, what's interesting is the people that do sort of relapse or do sort of, don't fit that 59%, they actually, their quote unquote relapses might be a stressful thing happens, a death in the family, a relationship breakup. They might smoke 3 or 4 times. Like, it's not really going back to sort of full on smoking. And somehow with this psychotherapy, their attitude towards smoking changes as well, which is kind of what we've talked about with psilocybin overall as a medicine,
Right.
is that it gives us access to parts of the brain and allows us to sort of make changes in the way people see themselves. So extremely excited. And, we're going to kick off, we're going to supply the medicine for the NIDA grant study. And at the same time, we're going to kick our seamless phase 2, phase 3 off fairly soon. And just to sort of offer people, and you think about sort of the parents in Canada, that are smoking outside in minus 20 in the winter.
Yeah.
They've got an asthmatic kid inside. They feel guilty every time they do it, and they wonder about, what they're doing to their kids' lungs, not to mention their own. So I think to offer people something with, one dose and psychotherapy and, majority of people no longer smoking after that is extremely exciting.
Yeah, it is. Wanted to touch on Compass Pathways positive results that were announced in Miami. What was your big takeaway based on it?
Yeah, my takeaway, they were positive, right? I know not everybody reacted that way.
It all depends on who you ask, but there's some people that they go ahead.
As a psychiatrist that's in the trenches treating people, I think there's a few simple things that we need to keep in mind. One is the population was treatment resistant, right? So it was treatment resistant depression. It wasn't anybody that walks off the street that has depression, right? So these are people, depending on how you define it, typically they've had
Can you explain just for people that are learning what the true understanding of treatment resistance?
Sure,
obviously
absolutely.
The words are pretty simple, but
so what it means is that they have failed, at least two adequate trials of different antidepressants, right? So it really means that you're picking people that do not respond to the treatments. So,
gotcha.
So it's kind of like if there was metastatic cancer that had spread and the doc says, hey, there's nothing more I can do for you. And then we got 20% of them to stay alive, right? To me, it's this kind of, so I think somehow, it's in the paperwork for sure, TRD and all this stuff, but I don't know if everybody kind of gleaned on that. So 25%. Now, they will go back and again, like everybody else, unlike the MAPS results for the PTSD, we're not seeing a published scientific paper yet. This was more like a release and some early information. Once we read, we'll understand the population more. We'll understand what was the psychotherapeutic approach taken, and they may retool their approach to it. But I think at the end of the day, these are people like if they haven't responded to 2 adequate trials, my expectation for them to respond to a 3rd trial would be very, very low. Right. So I think even though, the mid-20s sounds like it's not much, if you're that person, it's great. You've got your life back.
Yeah.
Right. So I
think this is important for people to understand. I think short term, there's a lot of expectations that people were hoping for. It's had an effect, obviously, on the market, to say the least, over the last couple of weeks. But I think it's
depression is the number one cause of morbidity, of missed time off work in the Western world. Right. And if you can offer some hope to the hopeless,
think about
not to mention suicide, not to mention all the other stuff. So if 25% of the treatment resistant depression can get better with this, again, 1 dose and psychological support, that's actually quite amazing when you realize the multi-billion-dollar impact it has on our economy, but also the impact it has on families.
And one dose, of course, too.
In one dose in therapy. Yeah, exactly. So again, we will tweet it. Maybe 2 doses make a difference. Maybe a different therapeutic approach. Maybe we can push that number up. But certainly 25, and it was helpful as well. The 1 milligram, 10 milligram, 25 milligram. It sort of reassured us that the 25 milligram is a reasonable dose, which is what we're looking at for smoking and for PTSD as well. So there were some nuances in that study that I think the whole community will find helpful.
It's good to know. I like you hearing some of the things to point out because it can be a little overwhelming to say the least for a lot of people that are new to the space and trying to learn. But the key here is that I always give the comparison where it's 1 dosage versus taking SSRIs every single day. It's a
for the rest
difference.
of your life, exactly. And so the people that respond to the SSRIs, I mean, quite often they're also living with side effects, right? They're living with. I mean, again, I use them, I prescribe them. So I'm not going to start bashing sort of because it's the best we have for now. But there's sexual dysfunction, there's weight gain, there's some, there's a flattening of mood overall. So people know when they're on these medications. So yes, you've improved the mood, you've improved the energy, you've improved the concentration. There's definitely that, but there's sort of a price to pay for it. And we're talking about psychedelics, which will be out of your system, within a day or so. And so,
I want to shift now to New York City.
Yes.
You and I were at an event in Miami, and you and I took an Uber back to the hotel, and I think you were in and that was probably around 11 o'clock, and I think you were in New York City the next morning at 10 a.m. to do a presentation. Well, so needless to say, you were hard at work, but it was called the Horizons Veterans and Family Forums event that took place, as I said, in New York City. You participated in the State of Care and the Case for Psychedelic Therapy panel. So talk to me more about the event and maybe some of the key people who were there.
Well, it was an incredible thing to be invited to. And my colleagues, Bob Kaufman, Rachel Yehuda, different sort of players were in the field. And so it's Horizon. It's an organization that is sort of promoting psychedelic medicine in veterans. So it was the day before our Remembrance Day, the U.S. Veterans Day. So it's on the 10th, the day before, and it was set up in a beautiful little church in Manhattan. And there were two panels, and I took part in both of them actually, just not just the one that you mentioned. But the first one was a series of talks for veterans, healthcare workers, and for families of veterans, people. So it's sort of a more closed one. Then a couple of hours later, they opened it up to a community session as well. And really, it was such an incredible coming together. Again, it's the idea, we talked about the different groups. So we had people like Heroic Hearts who support, taking people on a plane to Costa Rica and doing the traditional kind of a healing process. Then you had people like myself and some of the scientists and clinicians that are talking about, let's do these randomized controlled trials and get the evidence going. And both sides were very respectful of each other, in the sense of, I'm not somebody that's going to go, and sort of promote sort of the, I won't call it underground, but you know what I mean, like taking people and helping them. They have good intention, because for me, if we're going to really get these medicines across the board, we're going to have to do the research side. We're going to have to be patient for it. And, so it was an incredible event, a lot of interest.
What was the vibe like?
The vibe was solid. It was very, very supportive. Everybody was on the same page. I think, what we have, I brought up it's interesting. I sometimes bring up the health equity thing. As a guy that served 31 years, I know the whole world loves veterans, right? The whole world loves first responders. So you're not going to have much difficulty raising money, raising charitable funds in most of the world to be able to get medicines like this into veterans, whether it's above board, in a more sort of casual kind of way. But what about refugees? What about people that have been sexually abused? What about other trauma survivors, right? The only way to get medicines to them from a health equity perspective is to do the science, so that the insurance companies, the providers, all of these different organizations, the funders, buy into this as a real alternative option, right? So I think that the vibe there was very positive. Day before Remembrance Day, and Veterans Day, and we're talking about veterans. So, very, very positive energy. But I was sort of excited by just the fact that, I got a chance again to meet some of my colleagues from the US VA system, from different organizations. And, we had a chance, sidebar discussions to talk about collaboration and really, again, upping the game from the science perspective.
I have to ask you one last thing. Mike Ellis' recent statement around psychedelic-assisted psychotherapy and how this proves that these types of treatments are gaining acceptance. And for those that don't know who Mike Ellis is, he's a former police officer turned politician, is now the Associated Minister of Mental Health and Addiction. He went on to say The evidence is emerging that psychedelic-assisted therapy is a promising practice whose time as legitimate therapy in Canada has come. What's your take on that?
Well, that's amazing. And he said that in Calgary while we were in Miami. He said it. The Newly Institute has opened up its new sort of flagship clinic in Calgary, and he actually went to the opening. And I'm thrilled because, as you know, I mean, in Canada, more and more of the provinces have started to have, ministers of mental health and addictions. And with this latest government, Carolyn Bennett has been named the same. So it's splitting off the health ministry, but it's kind of, to me, acknowledging, what a big beast this mental health and addictions is. In the military, we created a directorate of mental health. Again, within health services, we don't have a directorate of orthopedic surgery, right? So the idea of understanding that it's the level, but so far we've had Sir Nick Carter, who's the head of the British Defence Force, the head of the British military, advocate for psychedelic research and psychedelic medicine. And now we've got Mike Ellis saying the same thing. So I think the idea that the ministers that are responsible for the mental health addictions, they're looking at that file and they're looking at the gaps that we have in the current treatment. We're looking at how many people, despite treatment, continue to suffer. And they're saying, let's think out of the box, right?
Well, you said it best in Miami when I met with you. You're like, it's not so much being fixated on psychedelics. It's just you're looking for more solutions for military veterans, right? And and it just so happens that, the data that's being produced from some of these compounds, it's not just a little bit promising, it's overwhelmingly promising.
Overwhelming. It really is. And you hit it on, I mean, my interest is in reducing the suffering of people that suffer. And if psychedelics is the route, let's do it.
Right.
If virtual reality-based treatments are, let's do it. Let's be innovative, and let's not be satisfied with the status quo, right? I think that's the key to complacency. I think because every file, every name represents a person suffering and a family suffering, and we need to sort of look at that and just say it's not good enough, right? And we need to. We've made advances in cancer. We've made advances in heart disease. We've made advances. It's time for us to put that. I mean, look at COVID, from the deadly disease to the vaccine. Bang, right? So when you put money into stuff, and I think what politicians can do by giving this space credibility, we want to start to see funding. I mean, Matt's got the NIDA grant, so the federal government has funded it. There is some funding coming from different organizations. So let's go after this funding to do the research the same way we do other research. Also, like you said, the insurance companies are interested because the insurance companies, I mean, instead of paying somebody to be off on disability for 10 years, let's pay them to get an effective treatment and get them back working. I mean,
I've actually learned recently that a lot of the times the insurance companies are gauging as to what the cost would be based on the amount of overdoses or hospital visits that people have had through opioid issues.
Insurance companies do this fantastic, almost creepy actuarial science, right? And the idea, and depression has this impact because unlike some of the other diseases, it often doesn't kill people right away. So you can be depressed for 20, 30, 40 years, right? So you're off work, on work, off. And so the cost of depression is a lot more than a fatal car crash, for example, right? And so the idea of being able to put a dent in that, the economic burden is one thing. The impact that it has on workplaces, the whole concept of absenteeism, but also presenteeism, people that are at work but not really at work, not working their best. So I think I think we have a really good business case once we prove the efficacy of these medicines. But ultimately it's you really have to think about, there isn't a family on the planet that hasn't been affected by mental illness, and just to watch people sit there and suffer and spiral and go for care and try meds.
Currently going through it right now, and I think there's a lot of people that can relate to that sort of stuff. But there's a lot of
let's do it safely. Let's find this and let's give them more options, because the more options also give hope, right? And you give hope to the hopeless. I mean that's really should be what we should be trying to do.
Here's the key takeaway too. What I really, really admired about the industry. There's a lot of companies that are very supportive of each other. I saw obviously your team, obviously with the Cybin team, and vice versa. It was like, you know, unlike cannabis, where it was just like everybody was trying to
You know what?
leapfrog each
Yeah,
other.
I see. I mean, constantly emails, texts, LinkedIn invitations, and I just think everybody is. I mean, from a company perspective, you know, there is going to be some IP. There's going to be some things, but I think that as we were meeting more and more people, we were sitting. And we were finding, especially the like-minded companies, the ones that are really saying, okay, these molecules are a good starting point, but let's make them even better. Let's do this. There was a lot of sort of collaboration and sharing and sort of common vision. I think that
You're going to see a lot of that coming into the 2022 for sure.
Yeah, I think so. I mean, and there'll be some consolidation of companies, I think, as things move along. But that's natural. I think that's natural.
Yeah,
and
growth of an industry.
Yeah.
Listen, love catching up with you. I could sit here and talk with you all day, but it's always a pleasure. And I was so happy to obviously meet you in person. And
it was great.
For those watching, Dr. Jetly, one of the most stand-up people you ever come across, but affiliated with Mydecine, which trades on the New York Exchange under the ticker symbol MYCO, and under the OTC, under the ticker symbol MYCOF. Appreciate your time.
All the best. See you soon.
Yeah, let's keep in touch.
Bye.